Thank you very much. I'm actually overwhelmed that we've got an exciting list of people to speak on this issue. I'm very passionate and I'm also motivated and sometimes tearful about the state of racism in modern Britain. I'm just looking for my PowerPoint presentation to look what I'm trying to discuss and outline in the next 15 minutes. So my name is Colin King, and they actually label me one of the worst pathological and demonizing terms. I'm a service user with a lived experience, and my lived experience is something called a diagnosis called schizophrenia I've had from 17 years of age. But if you look at these pictures, I think what they begin to do is indicate a real major concern for British society about how we define racism as a public mental health concern. And I'm going to use the word atrocity. It's not a concern for me, it's a form of atrocity violation. And also, I think there's a call for a reparation for the number of people that have died since 1656, when Cartwright made a diagnosis of drapetomania, to something that still persists in our national consciousness and framework, the notion of schizophrenia. And if you look at these voices, these pictures, we can begin to actually outline the impact of institutional racism in British society, from the murder of Stephen Lawrence in 1993, when we got the definition of something called unwitting, like it's unconscious. But there have been victims in this period of time. And the victims are pictured here, from Sean Riggs to the mammoth loss and murder of Dalian Ackerson, who's a police officer. And just listen to this. Visualize this. A person walking home is tasered for 53 seconds. He falls on the ground. He's kicked in the head with such a ferocity that his mouth opens, and he's kicked again, and he dies in custody. This is not one person. This is a catalogue, an escalation of number of people that have died in the system. From Barona Taylor, who actually died in police custody. So we have a major issue to begin to understand how we're using race as a definition. Now, Shada will go into much more detail about the clinical issues. I just want to the structural framework around race and how has it evolved as a definition from the 1965 Racial Relations Act to the amendment in 2000. I want to give you a definition that's more relevant to the experiences of the interconnected identities of race that exist today. If we can just go to the next slide, that'd be really helpful. So most people, I've been in lockdown for a year and it's the safest I've ever felt. So I'm Colin. My aim to discuss the experiences and identities. And we're looking at race to look at the interconnected frameworks and variables that affect who we are as a Black male from a working class Christian background, from an Afrocentric family who's been pathologized by structural racism within a range of political structures. And we want to find out how this permutates as a reality, as a pain through the family, through the school, and through what we call a notion of being misdiagnosed. Is that okay?
Yes, we can hear you clearly.
Yeah, I do apologize for that. You messed the best bits now. I'm sorry about that. It's all downhill now. You can go to the next frame. That'd be really helpful. So I'm going to start off by saying that racism is a politicalization of silence as a public health atrocity. And whilst other people may more go into the clinical and diagnostic framework, I want to begin for us to actually frame what we actually mean by racism, using the definition by the Black Power movement during the period of the 60s and the civil rights issue, when they defined it as expressed in practices of social and political institutions. And we must position and place mental health as a pivotal role in this relationship in the social and the political. But also racism is also about individuals and informal groups that are governed by behavioral norms that support race thinking. And so when we look at mental health, this is a crucial issue around how white, particular Eurocentric behavioral norms infiltrate a Eurocentric and eugenic approach to race in mental health practices. But most importantly, what this definition allows us to do is address disparities and outcomes. And also, we have a mental health system that's really a criminal justice system, a criminalization of Black experiences in the misdiagnostic framework. But we must see this as interconnected within other linking institutional settings, employment. I'm unemployed at the moment. Housing, the high percentages of people from particular background in poor urban inner city areas that resonate from the 1965 Housing Act, the implications of our hair care policies, and we know from recent research, particularly given to us by the government in terms of race and disparity report, the huge disparity issues between racialized communities that exist. But what actually makes that much more difficult is the lack of political power given to civil rights and Black community groups to challenge institutional racism within mental health care, and also as a public health concern. Let's go to the next one, please. So who am I? And this is the poem I wrote when my grandfather died in 2001. And I think it epitomizes the diversity of my experiences, but also how I am perceived in a racialized context in terms of structural discrimination. And in that context, it's informed by what I call structural discrimination. So I'm going to put a context to race and mental health. It's about this period of slavery and what it took away from an Afrocentric diagnostic framework that racialized and makes normative the experience of the cultural other. And all that, how that experience is actually denied within our current human rights legislation, our Equality Act, but mostly importantly, and Sade will go into great evidence in this, the criminalization of a diagnostic framework that is leading to the death, murder, violation of particular communities. And it's representing what I call a form of modern slavery in mental health practices. And I'm talking that from two oppositional positions. As a survivor who's been abused, restrained, controlled, overtly medicated and given a range of medication, and as a practitioner who's colluded and administrated with those particular practices. And so what that positions me is a diversity of an individual with two sons who also now have a mental health diagnosis or a misdiagnosis. So I'm going to introduce myself as Mr. Insane, schizophrenic, and psychotic. Those are my detailed normative label about how they see me as a Black man in this world, as dangerous, difficult, and threatening. But the other side of that positioning, in the reality of the African experiences, we are normalized through being a brother, son, father, uncle, and friend. But in the context of school, the first escalator of misdiagnosis, we're given, as I was, the notion of being educationally subnormal, delicate, and dyslexic. And that leads to an internalization where you actually distance yourself as somebody who wants not to be colluded within a white free zone. You have internalized dreams that are not articulated in the external world. You write that's seen as illegible and badly presented. You're perceived as mumbled, soft, but more importantly, in the context of British public concerns with race and mental disorder, you have become the #1 public concern. Your death, your violation becomes the capital of a white dominated society. And as I go to the next slide, you just let me know how much I've got left. What is really crucial in this positioning which I'm presenting today, without going into detailed analysis of mental health diagnosis and trauma, which Sade will concern, is how Black men are perceived and what distinguishes them as a public health concern, and how that concern emerges through this really important relationship. And what happened in 1980s was a case of Christopher Columbus, where Black men were perceived as somebody who were dangerous and led to the murder of a white person. the emergence of something called the care program approach, the elevated use of Section 3 of the Mental Health Act, the overrepresentation in the care program approach. But also, we must contextualize these public health concerns within a reality. The dysfunction of the Black family, the failure to position the implications of issues around gender, class, and sexuality, the notion that the education and imprisonment of the Black male experiences as somebody who's feared, and this notion of urban integration. As I move to, I think it's my last slide, I do presentations, and sometimes how people speak is really important. There are three people positioned in this: racism as a public health concern, the escalator of disempowerment. The first picture is a famous picture of a story about how we perceive and look at ourselves. And in that picture, we look at the public concern of what we call nigrophobia from the work of Fanon, how we choose whiteness as a superior image and the implications for our psyche. My son talks in this next picture, we haven't got time to listen to it, about how counseling interventions, psychological and psychiatric interventions are the new slave trade. He calls it probation, imprisonment, denial of the culture, who he is as a person. And then we go to Black women, which is really an underestimated, unresearched implications about how women are positioned as a public health concern and a concern. But last, I want to point to this, just want to play this last one. I think it's about 1 minute. Could he play the thing?
Yeah, I'm sorry, I know you very well, but I'm still quite angry with what you said today. And the tell you why I'm angry, as somebody who's had schizophrenia for a long time, is that you're putting the plaster to something that's already taken place, rather than doing with some historical cause and political factors. And for me, unless you dismantle this political system that imprisons and criminalizes Black men, unless you change these underlying Eurocentric white models, which we're all guilty of, irrespective of our races, we'll continue to have the underrepresentation of certain groups in this story. I think, is there a time now for us to have a government inquiry about why are Black men illegally imprisoned in a mental health system, which for the last 40 years hasn't worked for them? Is not a sense of that the government should take this much more seriously, because we've had a history of equality training, awareness training. We've been through it all. And through that training, people have learned behaviors but haven't learned the right responses, or they are political advocates of the people they represent. I'm just advocating that the Black White Network and all the people here should be standing together, would unite the space and actually saying we need to galvanize politically to challenge the system, because the system doesn't work. The story we heard this morning for 2 years is just one part of the story. Collectively, we have dismantled and eroded the Black community. So I'm saying to you now, love what you do, but this is a really fucking serious issue.
Totally agree with you. Couldn't agree more. And as I hope came over in what I said, which is that, I've spent 30 years approaching things in the way NICE does, NHS England does, and it hasn't had the impact that I think we all would like. So, I think your point is well made.
But can we do this? Can we take it as a government inquiry about why are we so overrepresented? I don't want policies and procedures, inequality. I want a serious political investigation of why this is still happening in 2019.
I'm not in a position to be able to grant that or not.
Would you agree with that needs to happen?
I think that we need to do more than we are doing. A lot more, yeah? And I mean, you probably know as well as I do that I can't suddenly commit to this is what we should do next without that going through a lot of political hoops. But I do think it's not enough.
So I ended this story with my challenge to Professor Tim Kendall. We as a nation, as a country, as an individual, as a conclusion to this presentation, are not doing enough to ensure to recognize and to respond to the central question here, that racism is a public health atrocity in mental health practice. Thank you.